There was a woman who noticed a strong, sour smell under her arms for months. She tried everything: stronger deodorants, frequent showers, changing her diet. Nothing worked. She thought it was just hormones or maybe stress. But months later, she was diagnosed with breast cancer. That strange smell was her body trying to send her a signal. The truth is, our bodies are smarter than we think. They can send out early warning signs when something's wrong, and sometimes those signs come through smell. We don't always link odor with it, but in some cases, a sudden or unusual body smell could be an early clue, especially when it comes to cancer. So today we're going to talk about 8 unusual body odors that may be signs of certain cancer. Now don't panic if you've noticed any of these smells. Don't always mean cancer, but they shouldn't be ignored either. Now let's start the video. Number 8, foul breath. Everyone gets bad breath sometimes. Maybe you ate garlic, skipped brushing, or woke up with morning breath. That's totally normal, but what we're talking about here is something different. Persistent bad breath that just won't go away, no matter what you do. This is called halitosis, and it could be more than just a dental. If your breath constantly smells foul, like something rotten or metallic, it might be a sign that something deeper is going on inside your body. In rare cases, it could be to stomach cancer or even lung cancer. Some tumors, especially digestive or respiratory, can change the balance of bacteria in your body. This can lead to sulfur compounds. Those are the nasty-smelling chemicals your breath. So, when should you worry? If your breath smells strange, metallic, or like rotting tissue, and it sticks around for weeks, even when you brush, floss, use mouthwash, and keep your mouth clean, it's time to pay attention. Now, don't jump to conclusion. Persistent bad breath doesn't always mean cancer. It could be gum disease, dry mouth, or even certain medication. But if it's new, getting worse, and nothing seems to help, get it checked out. It's always better to catch them early. Number 7, fishy or metallic smell from the skin. Your liver and kidneys are your body's natural. They clean your blood and help flush out toxins, your urine, sweat, and other processes. But when something's wrong, like liver or kidney, those filters don't work. When your body can't get rid of it properly, toxins start to. One of the byproducts is a thing called ammonia, which has a strong, sharp, almost metallic or fishy smell. That smell can actually come out through your skin or your sweat. This condition is sometimes linked to something called uremia, which happens when the kidneys are failing and waste starts to build up. In the case of liver cancer, the liver might not be processing toxins correctly, causing a similar error. People who are dealing with this might also notice other symptoms like constant fatigue, yellowing of the skin, swelling in the legs or stomach. If you or someone you know suddenly develops skin odor and it doesn't go away with regular hygiene, it's worth getting checked, especially if it's accompanied by other symptoms, tiredness, yellowing, or bloating. Now, of course, not every strange smell means cancer. Dehydration, certain diets, or even strong-smelling foods can cause body odor changes. But if this fishy or metallic scent sticks around and your body feels off, it's better to be safe and talk to a doctor. Number 6, fruity or sweet smell. If your body or breath suddenly smells sweet or fruity, almost like overripe fruit, or even like nail polish remover, it might seem harmless. Some might even think it smells clean. But in certain cases, it could be a quiet warning sign from your body. This kind of smell is often linked to problems with how your body processes sugar. And sometimes it's tied to serious conditions like pancreatic or liver cancer. The pancreas plays a major role in the hormone that helps move sugar from your blood into your cells. If something's wrong with the pancreas, like a tumor, your body might not produce insulin properly. This can lead to something called cancer-related diabetes, or, in more serious cases, diabetic ketoacidosis. When that happens, your body starts burning fat for energy instead of sugar, and that process creates chemicals called one of those ketones is acetone. Yes, the same stuff found in nail polish. That's where the sweet, fruity, or chemical-like smell comes from. Along with the smell, you might notice other symptoms like frequent urination, blurred vision, unexplained weight loss, extreme thirst, or hunger. If you notice this sweet or fruity scent coming from your skin or breath, and it sticks around even after good hygiene, don't ignore it, especially if it comes with those other symptoms. Now, to be clear, this smell doesn't automatically mean you have cancer. It could be unmanaged diabetes or even a strict low-carb diet. But if the smell is new, strong, and doesn't go away, it's worth getting checked. Number 5, rotten or decomposing. This is a tough topic, but it's so important to talk about. Sometimes a woman might notice a strong, rotten or smell coming from vaginal. It can be sharp, foul, and very noticeable, often mistaken for poor hygiene or a lingering infection. But in some rare and serious cases, this kind of smell could be a warning sign of cervical cancer. Too many women feel ashamed or afraid to talk about it, thinking it's something they've done wrong. But this isn't about hygiene, it's about health, and catching something early can make all the difference. If you're noticing a persistent foul odor, especially with abnormal or discharge, it's time to speak with a doctor. It doesn't always mean cancer. Infections like bacterial vaginosis or STIs can also cause similar symptoms, but it's not something to ignore. Your body deserves care, not shame. Listen to it, trust it, and don't wait if something feels off. Number 4, foul body odor. Despite cleanliness, imagine showering daily, using deodorant, staying clean, yet still noticing a strong, unpleasant body odor that just won't go away. If this happens, and especially if it's coming from a specific area, it might be more than just sweat or hygiene. When skin cancer grows on the surface of the body, it can sometimes turn into an open wound or lesion. These areas can become infected or start breaking down, producing a rotting or sour smell. It's not because someone is dirty, it's because the cancerous tissue may be dying or attracting bacteria, which gives off a strong odor. This kind of odor is usually localized, meaning it's coming from one specific area, like a patch of skin or the breast. It might also be accompanied by a wound or sore that won't heal, leaking fluid or pus from the area, skin that's breaking down, peeling, or crusty, redness or swelling that doesn't go away. Number 3, musty or moldy. You ever walked into a damp basement or opened a box of really old books? That musty, slightly sour smell, believe it or not, can sometimes come from the human body when something's not quite right. This kind of odor has been linked to liver problems, including liver cancer. And while it's rare, it's something worth paying. Now, this doesn't mean that every unusual body odor is a sign of things like poor diet, medications, or infection can also change your body. But if this musty smell is new, persistent, and coming along with other symptoms like yellowing the skin or eyes, jaundice, chronic fatigue, swelling in the belly or legs, unexplained weight loss, or appetite changes, it's definitely time to see a doctor. Remember, your body has subtle ways of warning you when something's wrong. A strange smell might seem small, but it can be a whisper from your organs asking for help. So, if you or someone you love starts to scent that just won't, don't brush it off. Number 2, every woman has a natural vaginal scent. It can change slightly throughout the month because of hormones, diet, or even stress. That's completely normal. But when the smell becomes unusually strong, foul, or chemical-like, and it doesn't go away, it could be your body trying to signal something. In rare cases, this kind of odor may be linked to cervical or vaginal cancer. Many women try to ignore it or think it's just a hygiene, but it's not about how clean. This is your body asking for attention, not judgment. Some women also notice the odor comes with other symptoms like bleeding between periods, bleeding after sex, watery, discolored, or bloody discharge, pelvic pain or pressure. If you notice a persistent, strong odor that wasn't there before, and especially if it's accompanied by unusual bleeding, please don't wait or feel embarrassed. It might be nothing serious. It could be an infection like bacterial vaginosis or an STI, which are treatable. But if something feels off, it's always better to get it checked by a doctor than to live with worry or wait to. Number 1, unusual urine or smell. If you've suddenly noticed that your urine smells very different and stronger than you, it might be more than just something you ate or dehydration. In some cases, especially if the change doesn't go away, it could be related to your urinary digestive tract. And in rare situations, it might even be an early warning sign of colon, bladder, or prostate cancer. Feces with a sickly, rotten, or metallic odor that doesn't seem normal. This kind of smell might be persistent, something that doesn't come and go with your diet. You might also notice other warning signs like blood in your urine or stool, constipation or diarrhea that lasts more than a week, pelvic or lower back pain, feeling like you can't fully empty your bladder or bowels. Of course, these symptoms can also be caused by infections, kidney issues, or digestion. But if something feels off and keeps showing up, it's always smart to get it checked out. Don't feel embarrassed. Your body is communicating with the only way it can. And that strange smell you're noticing could be a chance to catch something that becomes dangerous. So, if your bathroom habits suddenly change and the odor is just not normal, listen to your gut. Literally. You know your body better than anyone. Don't keep this information to yourself. Share this video with your friends and family. You never know who might need to hear this. By sharing it, you could help someone catch those early signs before it's too late. Take care of yourself and remember, your health is worth paying attention. See you in the next video.